Are you tired all the time? Do you feel weak, dizzy, cold, or low on energy? Is your hair falling more than usual? Do your nails break easily, your face look pale, or your heart beat fast after small effort? Many people ignore these signs. They say, maybe I am lazy. They say, maybe I am just stressed. They say, maybe this is normal. But sometimes your body is not being lazy. Sometimes your body may be low in iron. Iron is a mineral your body needs to make hemoglobin. Hemoglobin is the protein in red blood cells that carries oxygen from your lungs to the rest of your body. When iron is low, your body may not make enough healthy red blood cells. Then your muscles, brain, skin, and organs may not get oxygen as efficiently as they should. That is why low iron can make a person feel tired, weak, dizzy, short of breath, cold, and mentally slow. But before we go further, this is very important. These symptoms do not prove that you have low iron. Tiredness, hair fall, dizziness, weakness, and pale skin can also happen because of poor sleep, thyroid problems, vitamin B12 deficiency, vitamin D deficiency, stress, depression, pregnancy, infection, dehydration, diabetes, poor diet, hormonal changes, or other medical conditions. So this video is not a diagnosis. It is a simple educational guide to help you understand when low iron may be worth checking. If symptoms continue, feel severe, or affect your daily life, please consult a qualified doctor. And do not take iron tablets blindly. Too much iron can be harmful, and the real cause of low iron must be found. Now let us talk about the signs. Sign number 1, extreme tiredness. Tiredness is one of the most common signs people notice, but this is not normal tiredness after a long day. This is the type of tiredness where you sleep but still wake up heavy. You do small work but feel drained. You climb stairs and your body feels weaker than before. You want to do things, but your energy does not support you. Low iron can cause tiredness because the blood may not carry oxygen as efficiently. Oxygen is needed for energy. When oxygen delivery is affected, the body can feel slow. But remember, fatigue has many causes. If you are always tired, do not only buy supplements from the pharmacy. Ask why. How is your sleep? How is your food? Are your periods heavy? Are you eating enough iron-rich foods? Are you losing blood from anywhere? Do you have stomach issues? Are you pregnant, breastfeeding, or recently postpartum? These details matter. Sign number 2. Dizziness or lightheadedness. Some people with low iron or anemia feel dizzy, especially when standing up quickly or doing physical activity. They may feel lightheaded, weak, or like they need to sit down. This can happen because the brain needs steady oxygen and blood flow. But dizziness is not always iron. It can also happen because of low blood pressure, dehydration, low blood sugar, ear problems, anxiety, medicines, heart issues, or many other reasons. So if dizziness is frequent, sudden, severe, or comes with chest pain, fainting, breathing trouble, confusion, weakness on one side, or severe headache, get medical help quickly. Do not ignore dizziness that feels dangerous. Sign number 3, shortness of breath or fast heartbeat. If your body does not have enough healthy red blood cells or hemoglobin, your heart may work harder to move oxygen around the body. Some people feel breathless after small effort. Some feel a fast heartbeat. Some feel their heart pounding. Some feel tired while walking, climbing stairs, or doing chores that used to be easy. This can be connected with anemia, but it can also be connected with heart, lung, anxiety, thyroid, infection, or fitness issues. So please take this sign seriously. If you have chest pain, severe shortness of breath, fainting, or a very fast heartbeat, seek urgent medical care. Sign number 4, pale skin, pale lips, or pale inner eyelids. Many people notice their face looks dull or pale. Sometimes lips look less pink. Sometimes the inside of the lower eyelid looks pale. This can happen when hemoglobin is low. But skin tone is different for every person, and lighting can fool you. So do not diagnose yourself by mirror only. If you feel tired and look unusually pale compared with your normal color, it is worth discussing with a doctor. A simple blood test can give more useful information than guessing from the mirror. Sign number 5, hair fall. Hair fall is emotional, especially for women. When hair starts coming out on the pillow, in the shower, or on the brush, many people panic. Low iron can be one possible contributor to hair shedding, especially when iron stores are low. But hair fall has many causes: stress, childbirth, thyroid problems, vitamin deficiencies, crash dieting, low protein intake, scalp problems, genetics, hormonal changes, medicines, and illness can all cause hair fall. So if your hair is falling more than usual, ask a better question. What changed in my body recently? Did I have heavy periods? Did I lose weight quickly? Did I stop eating properly? Did I have a baby recently? Did I have illness or fever? Am I under high stress? Is my thyroid okay? Are my iron stores okay? Hair is not separate from the body. Hair often reflects health, stress, hormones, and nutrition. Sign number 6, brittle nails or strange cravings. Some people with iron deficiency notice nails becoming weak, brittle, or spoon-shaped. Some people develop cravings for things that are not food, such as ice, clay, dirt, or chalk. This is called pica. Craving ice is a classic clue that some people report with iron deficiency anemia. But again, these signs need proper medical evaluation. If you or a child is eating non-food items, please talk to a healthcare provider. This can be dangerous and may point to a nutritional or medical problem. Sign number 7, restless legs or poor concentration. Low iron may be linked with restless legs in some people. Restless legs means an uncomfortable urge to move the legs, especially at night or during rest. Some people also feel brain fog, poor focus, or difficulty thinking clearly. This makes sense because iron is important for oxygen transport and normal body function. But poor concentration can also come from lack of sleep, stress, depression, anxiety, screen overuse, low vitamin B12, thyroid problems, or many other reasons. So look at the whole picture. Now let us talk about who is at higher risk. Risk factor number 1, heavy periods. People who menstruate can lose iron through monthly bleeding. If periods are heavy, long, or very frequent, iron stores can become low over time. Signs of heavy periods can include soaking pads quickly, needing to change protection during the night, passing large clots, bleeding longer than usual, or feeling weak during periods. Heavy periods are not something to silently tolerate forever. If your periods are very heavy, talk to a doctor. The cause should be checked, and your iron level may need testing. Risk factor number 2, pregnancy and postpartum. During pregnancy, the body needs more iron because blood volume increases, and the growing baby also needs iron. After birth, blood loss, breastfeeding demands, poor sleep, and not eating well can make recovery harder. Pregnant and postpartum women should follow medical advice about iron because needs can be different. Do not guess doses during pregnancy. Ask your doctor, midwife, or healthcare provider. Risk factor number 3, not eating enough iron-rich foods. If your diet is low in iron, your body may slowly run low. Iron-rich foods include meat, fish, poultry, eggs, lentils, beans, chickpeas, spinach, peas, nuts, raisins, iron-fortified cereals, and whole grains. There are 2 main types of iron in food. Heme iron comes from animal foods like meat, poultry, and seafood, and the body absorbs it more easily. Non-heme iron comes from plant foods like lentils, beans, spinach, and fortified foods. Plant-based iron is still useful, but the body absorbs it better when eaten with vitamin C. For example, lentils with lemon, chana with tomatoes, spinach with citrus, beans with bell peppers, iron-fortified cereal with strawberries. Small combinations can make a difference. Risk factor number 4, vegetarian or mostly plant-based diet without planning. A vegetarian diet can be healthy, but it needs planning. People who do not eat meat, poultry, or seafood may need more attention to iron because plant iron is not absorbed as easily. This does not mean vegetarian food is bad. It means you need smart combinations and enough quantity. Lentils, chickpeas, beans, tofu, spinach, nuts, seeds, fortified foods, and vitamin C foods can help. Risk factor number 5, stomach or intestine problems. Iron is absorbed in the digestive system. Conditions like celiac disease, inflammatory bowel disease, ulcers, stomach surgery, or other digestive problems can affect iron absorption or cause blood loss. If you have stomach pain, dark stools, blood in stool, unexplained weight loss, chronic diarrhea, or long-term digestive symptoms, do not ignore them. Low iron may sometimes be a sign of hidden blood loss or absorption problems. That is why finding the cause matters. Risk factor number 6, frequent blood donation. Donating blood can help others, but frequent donation can lower iron stores in some people. If you donate often and feel tired, dizzy, or weak, ask whether iron testing is appropriate. Now, how do you know if your iron is actually low? The safe answer is blood tests. Your doctor may order a complete blood count, also called CBC, to check hemoglobin and red blood cells. They may also check ferritin, which gives information about iron stores. They may check serum iron, total iron binding capacity, transferrin saturation, vitamin B12, folate, thyroid, or other tests depending on your symptoms. This is important because a person can feel tired for many reasons. Testing helps avoid wrong treatment. Now let us talk about iron supplements. Iron tablets can help when someone truly needs them, but taking iron without testing can be risky. Iron supplements can cause nausea, constipation, stomach pain, vomiting, and diarrhea in some people. Too much iron can build up and damage organs, and if low iron is caused by bleeding, ulcers, heavy periods, or another condition, taking tablets without finding the cause can delay the real diagnosis. So do not copy someone else's iron dose. Do not take injections without medical advice. Do not give iron supplements to children unless a healthcare provider recommends it. Iron overdose in children can be very dangerous. Now let us build a simple food plan. For breakfast, you can choose eggs, iron-fortified cereal, oats with raisins and nuts, or chana with roti. For lunch, you can choose lentils, beans, chicken, fish, meat, spinach, peas, or chickpeas with a vitamin C source like lemon, tomatoes, oranges, strawberries, bell peppers, or broccoli. For dinner, use the same idea: protein plus iron-rich food plus vitamin C. If you drink tea or coffee with meals, know that they can reduce iron absorption from plant foods in some people. So if iron is a concern, ask your doctor or dietitian whether you should separate tea or coffee from iron-rich meals. The goal is not to become perfect. The goal is to become consistent. Now let us create a simple action plan. Step 1. Notice your pattern. Are you tired every day? Do you feel dizzy? Is your hair falling? Are your periods heavy? Do you feel short of breath with small effort? Are your nails brittle? Do you crave ice or non-food items? Write down your symptoms and how long they have been happening. Step 2. Check your risk. Do you have heavy periods? Are you pregnant or postpartum? Do you eat very little meat or no animal foods? Do you have digestive problems? Do you donate blood often? Have you had recent surgery or bleeding? Step 3. Improve food gently. Add iron-rich foods. Add vitamin C with plant iron. Do not skip meals. Eat enough protein. Avoid crash dieting. Step 4. Get tested if symptoms continue. Ask your doctor about CBC and ferritin or other tests based on your case. Step 5. Treat the cause, not only the number. If iron is low, ask why. Is it diet? Is it heavy periods? Is it pregnancy? Is it digestion? Is it blood loss? Is it another health condition? Finding the cause protects your future health. Now let us clear 3 myths. Myth number 1. If my hair is falling, I definitely need iron. Not always. Hair fall has many causes. Iron may be one possibility, but testing is better than guessing. Myth number 2. Iron tablets are harmless. Wrong. Iron can help when needed, but too much iron can be harmful. It can also cause side effects. Myth number 3. Only women get low iron. No. Women with heavy periods are at higher risk, but men, children, pregnant women, vegetarians, frequent blood donors, and people with digestive disease can also develop low iron. Here is the final message. If you are always tired, dizzy, weak, pale, short of breath, losing hair, or craving ice, your body may be asking for help. Low iron could be one possible reason, but do not panic. And do not self-medicate blindly. Pay attention to your symptoms. Improve your food. Look at your risk factors. Talk to a doctor if symptoms continue. Use blood tests to confirm. And take supplements only in the right way. Your energy is not something to ignore. Your hair, nails, mood, focus, and strength are all connected to your overall health. When you listen to your body early, you can prevent small problems from becoming bigger problems. If this video helped you, subscribe to Healthy Habits Studio for simple health education that is practical, honest, and easy to understand.